For the past few weeks, I have been creating videos related to Icd-10 Pcs mastery. As it is a huge topic, I am creating these videos based on parts. So for the last few weeks, I have created two parts, part 1 and part 2, where we have learned few basic guidelines related to Icd-10 Pcs as well as root operations. So today's session is part 3, mastering Icd-10 Pcs for inpatient coding. As all of us know, Icd-10 Pcs is having 7 characters. So we have learned section, body system and root operation using our part 1 and part 2. So in today's session, we are going to see body part, 4th character, approach 5th character, device 6th character and qualifier 7th character. If anyone looking for medical coding jobs in India, UAE, ESA, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for same day surgery CPT coding training, please send WhatsApp message to 707-526-3939. And also if anyone wants to learn free medical coding, so these are the playlist which are present on Fastcoder 21. For example, if you are planning to write CPC exam, you can use this playlist. If you want to learn Icd-10 Pcs and CPT, you can use this playlist. If you want to learn inpatient coding, you can use this playlist. Now we will see 4th character in the Icd-10 Pcs code, which is body part. So what is a body part? So 4th character body part defines a specific anatomical site where the procedure was performed. So this is very important for even CPT coding or even in PCS coding also. So basically here body part denotes where the physician has performed the procedure. And again here we need to understand body system also, so which will provide a general indication of the procedure site. Combining this body part as well as body system provides a precise description of the procedure site. So anyway, no need to worry, we are having few examples here. So here it is the body system, musculoskeletal system. Okay. So what are the body parts included in musculoskeletal system? These ones: spine, cervical, thoracic, lumbar, sacral. Rib cage includes ribs and sternum, shoulder joint, elbow joint, wrist joint, hip joint, knee joint, ankle joint and foot and toes. For example, if you want to use the body system of blood and immune system, what are the body part values? So you need to use blood vessels, arteries, veins, spleen and lymph nodes. For example, physician is performing procedure on the spleen. Okay. So spleen is the body part value. So spleen comes under body system, blood and immune system. You need to choose blood and immune system under spleen. Next we will see few body part guidelines here. If a procedure is performed on a portion of body part that does not have a separate body part value, code the body part value corresponding to the whole body part. Okay. For example, physician is performing one procedure on one body part, but we don't have any separate body part value. Then how do you code? Here physician is not performing procedure on the complete body part. He is performing procedure on the only portion of the body part. How do you code this scenario? For example, here physician has performed procedure on the alveolar process of the mandible. So which is coded to the mandibular body part. So alveolar process is the part of the mandible, but we don't have any complete body part value for alveolar process. So here we need to code mandibular body part. In the same way, for body part, we are having few more guidelines related to coronary arteries. So the coronary arteries are classified as a single body part. So as all of us know, we are having multiple number of coronary arteries, but we need to consider all coronary arteries under one single body part. They are further specified by number of sites treated, not by name or number of arteries. So here, whenever we will code coronary artery procedures, we need to code based on the number of sites, not based on name or number of arteries. Separate body part values are provided to indicate the number of sites treated when the same procedure is performed on multiple sites in the coronary arteries. So basically, if the patient performs multiple procedures on the same artery, we need to code multiple times. So here we are having one example. Two dilations with stents of a coronary artery are coded as dilation of coronary artery, two sides with intraluminal device. Okay. So here, based on our guideline, coronary artery, we need to take it as single body part. Correct? So, but here, physician has used the stents using the dilation in two parts or two sides of the coronary artery. So we need to code two sides with intraluminal device. Two dilations, one with stent and one without, are coded separately as dilation of coronary artery one side with intraluminal device and dilation of coronary artery one side with no device. So if the patient performs two dilations and after performing the dilation, one is with stent and one is without stent. So we need to code two codes separately. Now we will see fifth character, which is approach. So basically what is the approach? So whenever patient wants to perform any procedure, how did the patient reach that site? So in ICD-10 PCS medical and surgical section, we are having 7 different approach values. First one is open, percutaneous, percutaneous endoscopic, via natural or artificial opening, via natural or artificial opening endoscopic, via natural or artificial opening percutaneous endoscopic, and external. So these are the different approach values in the medical and surgical section of the ICD-10 PCS. See, here is the open approach. So in open approach, physician will create the incision and he will dissect the tissues and he will perform the procedure. So in percutaneous approach, physician will not create any incision. So directly percutaneous, through the skin, he will insert the needle. So next one is percutaneous endoscopic. So here also physician will not create any incision. He may create small incision. So after performing small incision, physician will insert the endoscope through those incisions. Next is via natural or artificial opening. So here physician is inserting laryngoscope through the mouth. So here mouth is the natural opening and physician is inserting the scope. So if you see this one via natural artificial opening. So this is not endoscopic procedure basically. So physician will insert the instrument through the mouth. So if you see here via natural artificial opening endoscopic. Okay. So here physician is inserting the hysteroscope through the vagina or cervix. Next is external application. Most of the time this approach is useful for fracture repairs or dislocation treatment. Next one is via natural or artificial opening percutaneous endoscopic. So now we will see few approach guidelines. Procedure performed within an orifice on structures that are visible without the aid of any instrumentation are coded to approach value X external. So where physician will not use any instrumentation in order to see the procedure site. For example, if is resection of tonsils is coded to approach value X external. So as physician can't use or no need to use any instrumentation in order to see tonsils. Next one is procedure performed indirectly by the application of external force through the intervening body layers are coded to